colon surgery is very different from rectal surgery. I think in both fields, the major advance has been the availability of minimally invasive platforms to do these operations. So many of the patients are eligible for just having their cancer removed through small incisions that are done either laparoscopically or robotically these days. And that just affords patients a really easier recovery, earlier return to daily activity and to work. We're trying to really minimize the disruption a cancer operation causes in someone's daily life. The rectal cancer surgeries are a little bit more complex. The American College of Surgeons really taken the lead in ensuring high quality rectal cancer surgery across the country. It's a little bit more complex in terms of impacting people's bowel function in the longer term. And then the question of having an ostomy or a bag typically arises in patients with rectal cancer. So I think my message there is just, make sure that you are being treated by a center or a surgeon who's experienced in treating rectal cancer when it comes to rectal cancer.
I would say that in the last 30 years, the surgery for colorectal cancer has changed very dramatically and for the better. Perhaps the biggest change over that time frame has been the introduction of so-called minimally invasive or keyhole type surgery approaches. So 30 years ago, a patient would have an operation for a colon cancer and would probably be in hospital between 7 and 14 days. They would have a very large abdominal incision. They would be off work for 8 to 10 weeks. And it was a major trauma to the patient with a major disruption in their lifestyle. Overwhelmingly now, the majority of patients will have an operation done either laparoscopically or robotically. So they'll have an incision that is 5 to 6 centimeters in size. They will be in hospital maybe 2 days, all things being equal. And they will be, depending on what they do for a living, they'll be back to work in a week or 3 weeks or whatever. It's a dramatic difference in terms of the trauma associated with it, number one. Number two, the outcomes of surgery in terms of cancer-specific outcomes, the survival, the cure rate, whatever term you wish to use, is so much better nowadays. We have better surgical approaches with specialist surgical training. So the outcomes are better. For the patients who do get offered some additional treatments, such as chemotherapy, the chemotherapy that's available now is amazingly more effective than it was 30 years ago, number one. And number two is very, very much better tolerated than before. So the majority of my patients who are receiving a short course of chemotherapy after surgery are still at work. I mean, they don't lose time off work. So it's less disruptive. And then one other question that patients always want to know, what is the chance of me requiring a colostomy bag? The rate of colostomy in patients undergoing surgery for colorectal cancer has plummeted in recent decades. It used to be, upwards of 75%, and now it's in the region of 10%. And many of those patients, in fact, it's just a temporary stoma. So it's a world of a difference from, say, 30 years ago.